Hello, today we shall look at postpartum IUD or postpartum intrauterine device. In this case, we're going to discuss how you can actually use copper T IUD to prevent pregnancy. And this is done immediately when a woman has delivered or within 48 hours of delivery. In this discussion, there will be some questions that require that you should be able to actually generate the answers so that when we are having the physical lecture, we can actually discuss this in the lecture. So you need to take your time, go through what we're discussing now, and later there are questions that are actually interpolated within the lecture. Thank you very much. We are discussing about postpartum IUD. As I said, in this, we shall consider that when we're done with this session, you should be able to list all the clinical criteria that needed for a provision of postpartum IUD in the clinical setting. You also expected to describe the key method characteristics of an IUD given during the postpartum period, and we also expect you to discuss the advantages and limitations of using a PPIUD. And then also discuss the key elements of postpartum IUD service provision. Let's look at the context of why we actually have to provide IUD. If you know that pregnancy spacing needs to be at least 24 months after delivery, then the best timing is actually when she has just delivered. Sometimes mothers take long before they come back, and by the time they come back, they have not even taken maybe 6 months, they're already pregnant. So probably the best timing is when they're actually delivering. We also need to realize that there's a large unmet need of postpartum family planning worldwide and in our country here, and even in the local context here, you realize quite a number of women actually not getting these services. We also need to appreciate that there had been advances or research that made us understand that IUCD or IUD is actually safe in the immediate postpartum period. We also need to understand that there are newer ways of handling birth now, that most of the births are attended by people who are already skilled. And these skilled people can also be trained to actually provide a family planning. And one of them should be actually an IUD. Let's go through the basics of IUD. In this basic, we shall look at how this family planning method works. We also look at how effective and how long you can use it, and then also look at the advantages and limitations of this method, and then how you can be able to assess clients, and then also look at the side effects that accompanied this family planning method. And then also precaution, what do you need to take? Specifically, if you look at the mechanism of action, we need to appreciate that, one, the copper will actually interfere with the ability of the sperm to pass through the uterine cavity. So when you have copper ion here, the presence of the ion actually impairs spermatozoa from traveling through the uterine cavity. So that's one way of having that. The other way, of course, it might actually decrease the motility, how fast the sperm can run. And then also the tubal environment, the sites where implantation is supposed to occur, will also be altered. That means implantation becomes almost impossible. How effective are this method? Now, realize that this is one of the top tiers. The top tiers are those methods that are very easy to use and they are very effective. The effectiveness is gauged 99%. And that means that in a typical case, you find maybe 6 to 8 women will get pregnant among 1,000 users in 1 year of use. Of course, effectiveness is measured in 1 year of use. They normally use 100 women. And this is effective immediately it is inserted. That's a good thing about the IUD. And then also, the good thing is that as soon as you remove it, your fertility will return immediately. And then also, at least for 12 years, you see here we're saying at least 10 years, but we know that IUD now works for 10 years. But you can also use it as a short-term method. That means that you can use it and then take it out, and that's the beauty. Importantly, we need to remember what we call the medical eligibility criteria. These are conditions that can actually make use of contraceptives a little bit not safe for a woman. And WHO has actually categorized these medical eligibility criteria into 4. In category 1, 2, you can actually use this method. You realize that in category 1, there's no restriction to using the method. So you can just use the method without any consideration. In category 2, you actually realize that the advantages of using the method generally outweighs the what? The risk of associated with the method. Importantly, you need to remember category 3 and 4 where you are not supposed to use the method. In category 3, generally the risk associated with using the method outweighs the advantages. Ideally, you should not use the method unless there is no any other alternative that you can use at that time. So you may need to consider, and this needs actually expert opinion. So anyone ordinarily should not be able to do this. Category 4, the risk is too much that you should not use the method. And we, this is a question that I want you to go through, and then by the time you come to our class, you need to actually label here that for these conditions here, what make could it be for postpartum IUD? The conditions we're talking about here is puerperal sepsis. If a woman has puerperal sepsis, if a woman has an unresolved postpartum hemorrhage, if the woman has infected obstetric anal sphincter injuries, 3rd or 4th degree perineal tears, if they have, it is infected, what make would it be for PPIUD? And then also period between 48 hours to 4 weeks after delivery, what make would it be? And then also for membrane that has actually ruptured and taken more than 18 hours. So what make would it be? So we'll discuss that when you come. The second question that you need to also discuss and then you come with, and then we'll summarize in the class, is you need to summarize the advantages and limitation of using a PPIUD. So this is also something that I want you to go and see how you can get the information. When do you give IUD or a PPIUD? Normally, it's inserted within 10 minutes after delivering placenta. That's called post-placental IUD. You can also insert it soon after birth. That is between 10 minutes after delivering placenta to 48 hours after delivery. So that's what we call the immediate postpartum IUD. And then there are cases where if you're doing cesarean section, you can actually do it during cesarean section. That's what we call intracesarean IUD. For cases which is 4 weeks or more after delivery, you can also call that interval IUD. So it's also part of the IUD that you can provide. Importantly, we need to remember that you should not provide IUD between 48 hours and 4 weeks after delivery. So that's something that you need to remember very well. How do you insert post-placental IUD? And this can also be discussed in the next series that someone has will reproduce a stepwise way of inserting this. I think we will actually be able to share with you alongside this material that we have given you. You can actually use your hand. You can actually use a curly forceps, and then this is how you'll be able to insert the IUD. So the manual insertion versus the instrumental insertion, you need to weigh which one has more success which one has more expulsion. Of course, before you insert, there are steps that you need to do. Importantly, you need to remember that counseling has occurred, and this counseling should have occurred earlier during antenatal care or when she has just delivered. Counseling during labor is normally not a very good form of it, though you can actually exploit that avenue, but realize labor pain itself impairs a lot of thinking capacity of most of our women. And then maybe they can decide in a hurry, or they can actually not decide at all. So earlier counseling is recommended. You also need to make sure that the instruments are ready, and then the IUD that you need to insert is also available, and these are actually having a set that is sterile. You need to confirm that the woman wants the method. So apart from all this, you need to make sure that she's actually interested in the method you want to give her, and then you need to be able to identify the cervix well. That means there should be a speculum to retract the vaginal wall so that you're able to identify the cervix to apply the antiseptic. And this, then you should be able to slowly insert the IUD. Again, this will be seen in the stepwise video that we will share with you alongside this one. Importantly, we need to also remember that there's risk of expulsion, and this risk depends on the time of an insertion of postpartum period. Expulsion rate varies from as low as 3% to as high as 37%. But in general, it's between 10 and 14%. And this depends on a number of things. I think the next slide will explain a lot of these that we can cover. But importantly, you need to remember that the good surgical technique, the good technique for insertion reduce the rates of expulsion. And then also importantly, immediately after delivery, the post-placental, or the one that is inserted 10 minutes after delivery, has a lower rate of expulsion, as well as intracesarean IUD has a low rate of expulsion. The rate of expulsion here, I want to describe that it is related to the 3 C's. It is related to the 3 C's. The 3 C's here is the correct technique. You need to actually place it correctly up to the fundus uterus. You need to sweep the instrument to the side so that you don't cut away the IUD and then you come back with it. And then you also need to use the correct instrument. Curly placental forceps is much better compared to the ring forceps. So the curved curly forceps is long, and then it gives a very good placement up the uterine cavity. And then also the correct timing, the post-placenta, we already said, is very important. This again another set of questions that you need to discuss before you come for this lecture or for this seminar. Importantly, you need to know what is different about an PPIUD compared to the interval IUD. What is special? What is different about PPIUD? So I want you to have a list discussing what is special about or what is different about PPIUD. And also importantly, you need to tell us in your write-up what are the potential side effects and complications related to PPIUD and how you can manage them. So these 2 questions can also add on the previous questions, and this will discuss it in a small group discussion during the seminar. Let's look at the basics of counseling and then informed consent for an IUD. And this is a small course that we need to appreciate. In this counseling course, we want you to discuss the optimal time for counseling a client about PPIUD. What is the optimal time for counseling? Describe the content of counseling for PPIUD, and then you need also to demonstrate good counseling approaches that you will use, and then discuss the importance of informed choice and selecting a method. These are the objectives of the counseling lecture that we're giving. So when to provide an IUD counseling? When do you provide this counseling? One, when the woman is in labor. Although this is not the best time, but you could actually use this as an option. Okay? You can also provide counseling during antenatal care, not only for PPIUD, but you can also provide for the whole postpartum family planning services, because also the other family planning services can be used in the immediate postpartum period. There are some that can be used, there are some that may not be used. Since post-placental insertion of IUD is the most convenient time and has the lowest rate of complication, we need to actually make sure that providers should put efforts to make this a possible option. This means that there should be adequate training, adequate counseling during antenatal. So we need to go back to our antenatal especially when it's part of the birth preparedness, we need to include this message to that. Realistically, not every woman who benefits from this PPIUD comes for antenatal. Some women do not come for antenatal, or they go to antenatal elsewhere, like in our setting here. You realize some women go to antenatal in private settings, or they see particular doctors who may not be able to actually provide those services. So it's important that we need to find ways of having them covered, okay? They can be covered during antenatal. Of course, if they do in private setting, it would be good to include the private setting as part of that. During the early stages of labor, especially latent phase, this is also an opportunity when labor has not yet intensified. You could actually talk to these women about PPIUD and see if it can work out. During hospitalization, if a woman becomes sick in the hospital and they are staying in the hospital, we've seen a number of women admitted in the hospital. They are pregnant. Why don't we give them as part of the health education? They need to know about this. When they are prepared for a scheduled cesarean section, this is an important avenue as well. And then also when they have just been admitted in the postpartum period, it would be good to have them included. Include the husband in these things. It's important that you need to include the husband because male involvement is becoming a relevant topic every now and then. So inclusion of them may actually help a lot. You need to invite the husband in for counseling, have the husband to be involved even in a focus group discussion or a group discussion. You need to provide information that may actually facilitate the women to discuss with their husband if the husband are not come. And if it is possible, you can make a notification chart that you can use it as a follow-up for discussion with the husband of that woman. The component of PPIUD counseling should be, one, you need to provide general information on all benefits of pregnancy spacing, how important it is to space pregnancy. In this era, you realize now the cost of school fees and whatnot is running high. So this is an opportunity to talk to the men so that they are not stressed. They don't produce so many children. The only way to have this is probably to use family planning method. You also need to provide method-specific information about the IUD. In this case, you need to provide information about IUD. And then also you give advantages and then the limitation of the PPIUD, the very PPIUD that you want to provide, including the potential side effects. This is important. And then also you plan for any other next steps that may be there. You need to consider discussing the elements of the ideal contraceptive method. If you are talking about IUD, the ideal contraceptive method you should look at how effective it is, the action that the clients need at that time, what they need to remember about that, how will this method fail and how much would it fail? So the failure rates, you need to look at it. And then also, if it is permanent or not, you need to actually make them know. And how long does it take for them to return to fertility when they stop the method? And potential side effects and health benefits. There are what we call the non-contraceptive benefits of some of this contraception. So it will be good to air it out to them. And you need to also tell the woman, ask the woman how important these method characteristics are to her, especially the IUD. Of course, after discussing this all, you may need to ask such question. In the method-specific IUD, you discuss the key characteristics of the IUD. What is special about IUD? Discuss the limitations and then the advantages of using an IUD, and then discuss the differences between interval and then the postpartum IUD. The interval is normally which is placed after 6 weeks of delivery. So that's what we call the interval IUD. Explain any side effects that might arise and also the warning signs. Things that if she sees, she should actually visit a hospital. It would be good to let them know at that point. Now, the specific things about IUD is that you need to look at the effectiveness. Initially, we talked about this in the previous slides, how effective it is. The mechanism of action, we need to appreciate that. How the IUD is actually used, how it is inserted, how it is actually, how you can trim the string, how it is removed, okay? How they return to fertility. When should they come back for a checkup? All this you need to discuss with the woman as part of the counseling. You need to discuss the advantages of this method, okay? Especially if you place it immediately after delivery. What is the advantages? We need to also remind them that after inserting, they do not need to do anything to make the IUD work. So that's a beauty. You don't have any role to play here. Just insert the IUD and that's it. You need also to let them know when they return to fertility, which is immediate. You need to remind them that, yes, this has no effect on breast milk, and you need to also tell them that it is reversible and then it is a long-acting method of contraception. The limitation associated with the IUD insertion, like there may be some bleeding that occurs, especially in the first few cycles, but this is only for intercourse method, not for the PPIUD. You need also to look at things like it does not provide dual protection. Dual protection means that infection, it protects you from pregnancy as well as some of the infections that are transmitted sexually. Then a small risk of perforation. Of course, perforation might occur. So a small risk, you need to let them know. You also need to let them know that the high risk of expulsion should be known so that we do a follow-up about this. Importantly, we need to discuss the differences between the interval IUD and the postpartum IUD. The interval is inserted after 6 weeks. The postpartum is inserted immediately after delivery. We need to also appreciate that, yes, it provides protection immediately. It has just less side effects. Of course, cramping and initially will occur, but this will actually return to normal. Of course, high risk of expulsion compared to the interval. You need to look at that differences that are there. As part of the continuation of method-specific counseling for PPIUD, we need to discuss the warning signs and then explain to the woman what are the warning signs, when should they come back, okay? And the warning signs we talk about here is foul-smelling vaginal discharge, which may actually be different from the lochia. The lochia normally is not foul-smelling. You need to look at that. Then lower abdominal pain. When they present with the lower abdominal pain that is a little bit severe or is actually continuous, we need to categorize that as warning sign. And also sometimes when they are concerned that they're pregnant after, when they feel they're pregnant, they need to come back. Or if they're concerned that the IUD has fallen out, sometimes you need to come back. Informed choice. These are voluntary decision made by the client whether or not to use the contraceptive methods or to accept a particular procedure. An informed choice is a choice made by the woman, not by you. Of course, we have issues around informed choice because many things like the medical barriers, that explanation about this may not be so clear. Sometimes providers are biased and assume that the method that they have chosen is the best, or the method that they suffered complication, nobody should actually get it. And then sometimes they also there's lack of information, there's lack of proper counseling, and then limitation related to the myth, and then a misconception around the family planning method. To summarize counseling, we need to, one, gain the trust and confidence of our client. So when they gain this, we are able to actually discuss with them freely and then make sure they get informed choice. We need also to help this client to choose the method that is best for her and for our needs, based on medical eligibility criteria, based on a number of factors that are there, based on other conditions that are there. Then we need to also explain what she needs to know. There are certain information that she needs to know. You need actually to explain it as much as possible. You should not get tired being asked questions. You need to follow up on our questions and then make decisions, so that the decisions that you make, it's actually based on informed choice. We'll dive a little bit into infection prevention for postpartum IUD services. Of course, as a general rule, you realize that for us to get out of this session, we need to discuss the role of provider in infection prevention related to PPIUD insertion. This is very important. What is your role in preventing infection? We talked about infection that may actually be one of the complications. We need to describe infection prevention practices that are part of the services for PPIUD insertion. Of course, a definition of infection prevention, just to remind you, is that is the practice and procedures that limit the transmission of infectious agents to patients, staff, and the community. So it's a way of limiting infection from circulating in the environment. Many activities are done to make sure that we have infection prevention effected in an environment. Infection prevention practices are everyone's responsibility. It is for us, it is for you, it is for me, for everyone who is actually there, including the patient. But importantly, we need to take leadership, because we know what's happening, we know what can be good, what is bad, not the patient themselves. The practices for infection prevention during PPIUD services could be hand washing. You could actually do hand washing, use of personal protective equipment. You can actually use antiseptics as well. You can actually provide a septic technique during procedures. All the procedures for PPIUD should be provided in a septic way. The instruments that are used on a patient, it should be handled in a good way, reprocessed in a very good way, so that it can actually be used safely on another patient. And then how you can keep the house. Housekeeping is very important, and how you can be able to dispose the waste. You can see that in this picture we are showing you how you can wash the hand, okay? But in case the hand is not so soiled, you could actually possibly use alcohol hand rub or a sanitizer. You can sanitize your hand. But this does not replace hand washing. Hand washing is the best. If you must practice the best, you do actually hand washing. The usual PPEs, the personal protective equipment that are used during PPIUD insertions are, we need to, for post-placenta, we need to use the routine PPIUD for delivery. You've already gloved your hand, you already have an apron, you can actually use that. If you, in a setting where you have gowns, you have gloves, you have air cover, you have whatever it is, you can actually continue with that. So you don't need additional items for this. For immediate postpartum IUD, this is the one that is put 10 minutes after delivery placenta to 48 hours. This one you can actually use an apron, and then the gloves is enough. But of course, the other things should have been sterilized to make it work out. Intracesarean PPIUD, you don't need additional things, because this team already gone, they're actually doing cesarean section. They're in the uterus. They have already delivered the placenta. They can actually use their hands or use a long forceps to insert in the upper part of the uterus. What antiseptics can be used on the mucous membrane, including the vaginal wall, cervical membranes? You can actually use povidone iodine safely, which is okay. You can use chlorhexidine. We call it sometimes, the trade name can be Savlon or Ebiten or Ebicleanse. But do not use alcohol. Do not use hydrogen peroxide on the vaginal wall. Some people are so cruel, they want to use alcohol. That's too wrong. And you also need to read again, how does iodine work? Iodine for work. How long should you time? So that's a question that we will also discuss when we come. There are some instrument processing steps that you also need to remember, like decontamination. Decontamination, making sure that the instruments that you're handling is safe for you to handle. Okay? Cleaning we look at cleaning as part of removing visible soiling that are present on the instrument. That we call it cleaning. And then you can actually do eye-level disinfection or sterilization. Of course, sterilization means that you have wiped out the microorganisms with all their spores. But eye-level disinfection could have wiped out most of the organisms, but their resistant spores could still be there. Okay? And commonly, in our setting, we find people use autoclave. You can use eye-level disinfection by boiling or chemical soaking. We use Sidex in some setting to achieve eye-level disinfection. Housekeeping, you may also need to be aware what you can do when you've already done the service. If the floor is soiled, what do you need to do? These are the things that we need to discuss. You need to clean up after any procedure, dispose the waste in the leak-proof container, normally with a biohazard liner, bin liner, which is a biohazard bag. You need to place instrument in the bucket, which has the chlorine solution, 0.5 chlorine solution for decontamination, and then you wipe the surfaces using cloth. And then also some of the things, maybe like the beds, the trolleys, you need to wipe the surfaces. And then also the sharps should be deposited in a sharp container, which is actually leak-proof, so that nobody can get a prick, needle prick. So this is basically what we are supposed to discuss. I still remind you that you need to go through this. When you come for this seminar, make sure that you've already done part of the questions that are there. We'll sit in a group discussion and have it done, and then that is it. Thank you so much.